What's going on? We're filming? Yeah. People want to know, you know, your audience, don't forget, you're a doctor, you're vaccinated, you have COVID. Oh my God, but I look whatever, like I'm not ready, and I probably still have a fever. They want to know what to do, how did you get it, what do you suggest they do at home? I'll do it for the viewers. I just, I have to get ready. Give me 2 seconds, I have to. Okay. See if this works. Okay, much better. Better setup, look better. So, my amazing viewers, I want to make this video for you. So, I did get COVID. I am vaccinated. I'm an emergency physician, in case you don't know me. So how, when, and what I'm currently doing and what I suggest you guys could do coming up now in the video, okay? Enjoy. Disclaimer, I did not get COVID from traveling to Europe. Here's of my latest video. As you can see, I did a video blog of traveling to Europe. Here's a picture of the video, and you're gonna have the link up here because we follow all the COVID guidelines. Me and my wife were in the same place at the exact same time the whole time, and she, thank God, has no symptoms or no COVID, and it's almost a month after the vacation. So that was not it. Reason obviously why I got COVID is because as an ER physician, I treat COVID day in and day out, every single day. Sometimes I come in and the first 5 patients I see are COVID patients, okay? All right, so how am I doing? Well, I initially started this, feeling headache. I was getting this headache out of nowhere, just headache. I thought it was because I was tired, I slept 5 hours, I was working hard. But it's unusual. I was getting a headache. The next day I started getting some sore throat. It felt dry, itchy. Then at night I started getting dry cough. And then eventually I woke up with nasal congestion, a lot of sinus pressure. And I did notice my smell was off and I started not tasting things properly. First I thought it was because of a lot of congestion, but then I was like, maybe I have COVID. And then eventually I did get mild fevers, and those mild fevers were giving me headaches. They were correlated. And one day I did get some pain in the middle of my back that wouldn't go away, but that went away. So thank God, currently I just have congestion and occasional, very rare, like 1 or 2 coughs at night. And then I'm able to fall asleep, okay? So, most important part of this video, and maybe the part that you're interested in. So what did I do? What am I doing about COVID? But just disclaimer, these are not sponsors. I am not that important. I don't think I'll ever be on media to be important so they can sponsor me. These are random brands. And what I'm doing with COVID is, first of all, I want to give this advice because sadly a lot of people come to the ED looking for advice and help on what to do when they get COVID. Sadly, you're going to feel horrible. You're going to have flu-like symptoms. There's not much you could do. You could alleviate your symptoms, okay? So what I'm personally doing, this is no medical advice, no suggestion. It's just what I've been doing and a little research to back it up, okay? So, symptom control, I always recommend Mucinex. Mucinex is the brand, like the fancy brand Mucinex, but you can buy the generic Mucinex, which I buy Walgreens. As you can see, this is Walgreens. The reason why it's Walgreens and not CVS is because it's just closest to me. Simple as that. So, Mucinex basically includes a lot of the things to treat symptoms, and I bought the generic brand, and I'm gonna put a picture somewhere in this video, that way you can see it and read it, but I want to read it to you. On the green part, that is for nighttime. What you're gonna have is a couple things. This is what I'm saying. The Mucinex versus genetic brands. The active ingredients are all the same. This is what you should do with everything, with your vitamins, with cold and flu, everything. So acetaminophen, that's Tylenol, 325. That's obviously gonna control fever, pain, etc. You have dextromethorphan. Dextromethorphan is an antitussive. It prevents cough. Then you have doxylamine succinate. Doxylamine is a type of antihistamine, and antihistamine is like Benadryl, and usually that's a first generation H1 blocker. And what it does, it treats allergy symptoms, congestion, but also it can make you a little sleepy. That's why it's for the nighttime. And the other one is phenylephrine. Phenylephrine is another medication which is nasal decongestion. The way it works is going to vasoconstrict your vessels around your nose, preventing further secretion of the mucus. So it vasoconstricts to control congestion. And on the other side, for the daytime, you have all the same ingredients except the antihistamine for sleepiness. So there you go. Now you know what's in it, and this is going to control your cough, your congestion, your fever, a lot of things. So I think it's good. Number 2, vitamin D. I have a whole video on this. Here's a picture for the thumbnail, and I'll have the link up here. Vitamin D, I'm taking 4,000 units per day, international units. But again, vitamin D only helps if you are vitamin D deficient, not if you have normal levels. So again, on my other video that I put the link up there, you'll see that I was insufficient with vitamin D, so I needed to replete my vitamin D, because studies those show that having low vitamin D levels does predispose you to worse outcomes with COVID, as well as worse symptoms with upper respiratory infections. So vitamin D. Okay, consult your doctor. Don't just take it. Number 3, vitamin C. Again, random brand, no sponsor. I'm not that famous. I wish. Vitamin C. I take 1,000 milligrams a day. And vitamin C has been ongoing back and forth for decades, for many, many years. It does prevent the cold, the normal flu, etc. Most studies say no. They err on the side of no. But if you look at the NIH, they so far have neither for or against recommendations in vitamin C. And they quote one study, which is shown here. And that same study applies to zinc. And that study, I'm going to put it up here. Basically, they showed no improvement or significant difference between people taking either vitamin C alone, zinc alone, vitamin C and zinc together, or nothing. Standard of care outpatient, meaning outpatient, not in the hospital. And there was no difference. But in my case, I had good experience with vitamin C. I feel it does seem to decrease the duration of symptoms, as well as if you're about to get sick and you take a lot of vitamin C, it does prevent the mild cold or infection. That's just my personal experience, so that's why I recommend it. Also, again, don't just take this. If you're taking more than 2,000 milligrams per day, it may give you symptoms of nausea, vomiting, diarrhea. You can get abdominal cramps, you can get heartburn, so don't just take a bunch of vitamin C. Consult your doctor, okay? So now we quickly mentioned it, but zinc, I'm only taking 50 milligrams every other day, because this is a 50 milligram pill. The reason being is because the suggested dose, I'll put a picture here, is usually 11 milligrams or 8 milligrams depending female or male, I think. So, and taking more than 40 milligrams per day can give you symptoms, again, diarrhea, nausea, loss of appetite, dry mouth, and even metallic taste. So I'm only taking 50 every other day. And again, anti-inflammatory, helps with the immune system, antioxidant, etc. Okay, so ask your doctors. Then, last one, I cover 1, 2, 3, 4, 5. Aspirin. Again, baby aspirin, 81 milligrams. There are some studies on it currently showing some decreased ventilatory support, less bad outcomes in ICU, and people that were taking aspirin before getting COVID, they seem to do better. But again, those people taking aspirin before COVID, who knows if they were taking other medicine as well that made COVID less severe. We don't know. But aspirin is known, as a blood thinner, prevents clots. So in my case, I'm taking it for that reason, to prevent any clot formation. I'm currently taking 325 milligrams twice a day, 650, for the first 7 days. After that, I'm going to take, for the 4 to 6 weeks, 81 milligrams once a day. And it is known that orthopedic surgeons, after orthopedic surgeries, if you're going to be immobilized on your leg, your arm, they do give 325 milligrams of aspirin to prevent clot formation. So it is a known thing. That's why I'm doing it. But again, don't just take it. Ask your doctor, especially if you have gastric problems, GI bleeding, etc. Okay, ask your doctor. With aspirin, again, very rare to have toxicity with aspirin. You'll need a lot. But if you do, it can give you nausea, vomiting, confusion. You can get ringing in the ears. You can get rapid breathing, and something's wrong, okay? So go to the ER if you get that with new onset of starting taking aspirin. So that's about it in regards to what I've been taking, vitamin-wise, aspirin, etc. So what you should do if you get sick. Well, number one, ask your doctor. Double check, ask them about all the vitamins, medication, etc. If you are 55 and older and have certain comorbidities, you might qualify for monoclonal antibodies, or if you're 18, immunosuppressed, etc. That's a whole nother topic, monoclonal antibodies. But you should always have a discussion with your doctor and what you want to do, okay? So, really hope you like this video. If you did, please like the video down here. That way YouTube knows this is content worth showing to other people. So like the video, subscribe if you're not already subscribed. And I thank you so much, Here I'm going to put a video about vitamin D. Here's another video about what you should know about COVID. He's older, but it still applies. And then up here, I'll put vaccine videos and other videos that YouTube recommends for you. Okay? Thank you so much for watching. Subscribe. Adios.